I've had 4 pregnancy losses.
It all happened for Lisa Deacon in the span of 2 years.
I felt really, really disoriented during those 2 years. I was really challenged in a lot of ways, with grief, with mental health.
One especially hit her hard.
I did have a loss at 18 or 19 weeks. We're not exactly sure when she died. That I needed to deliver. I was quite traumatized from the birth experience.
Deacon was working while she went through it all.
My human resources manager was very professional, gave it to me straight, not very emotionally or compassionately, but gave me the information that I needed. My manager, she would be questioning kind of my ability to do the work because I was pregnant. And then afterwards projected, I felt onto me a little bit that I wasn't able to do the work because of what I'd been through.
She feels more awareness about pregnancy loss at workplaces would help.
It's not like one day you're pregnant and the next day you're not. Often it can be a couple of weeks that you're experiencing this. Bleeding at work, or you might be running around to a lot of appointments. Talk to the person who's experiencing it. Don't assume that they don't want to work. Don't assume that they do want to work. Really have that conversation.
Kellogg's recently announced new support for employees experiencing menopause, pregnancy loss, or fertility treatment. Measures will include paid leave and communication training for managers.
What we can learn from Kellogg's is that when governments and when legislation fails to lead on these issues, employers have the opportunity to step up and lead and be that example.
HR professor Jennifer Dimoff says many provinces offer pregnancy-related support, but it can be very restricted.
Who can access them, when they can access them, when they become eligible.
Dimoff says women often fear discrimination at work because of their pregnancy-related issues. She says employers need to be mindful when women take time off and opt for exceptions to accommodate their mental and physical health.
This is a human issue, and we're responding with humanity. Thinking about these benefits are not as extra benefits, but as equitable benefits.
Employment lawyer John Pincus says there are laws which protect women from discrimination at work.
An employee cannot be discriminated against not only because they're pregnant, but because they are trying to get pregnant. So that covers fertility treatments and whatnot.
Women can also take time off
from their employer and then produce a doctor's note.
Pincus says if your pregnancy-related issues are disabling you and your government or employers don't have a specific policy to cover you, you may qualify for a disability policy. He says doing your research is key. Sharmeen Somani, Global News.